Hey everybody, so I'm just going to do a quick podcast, if you will, tutorial, webinar on testosterone replacement therapy for men. It's something that keeps coming up over and over again. So recently, or a while back, depending on when you hear this or see this, I wrote an article on T Nation on why I quit using steroids. It was initially actually called "The Day I Quit Using Steroids," and there seemed to be great interest in that article, and within hours of that article posting online, and for several days to follow, I kept receiving messages from concerned readers regarding the article in relation to testosterone replacement therapy. So I was talking about quitting steroids, and some people were conflating that with, well, does that include hormone replacement therapy for men? So I want to get into that. I've talked about it before. I've written about it before. Here's the link to that article in case you haven't read it. I'll leave it up on the screen for a few seconds, and you can copy and paste that, and then you can read all about the unfolding, if you will, of what transpired that had me abandon using performance enhancing drugs forever, and to clean things up and get on with getting on. So anyway, that having said that, let me say for the record and emphatically so that everyone understands, stacking steroids, steroid stacking, and the polypharmacy of insane doses and variety of drugs used for bodybuilding, whether competitors or not competitors, that's a completely different world than testosterone replacement therapy. Now, I'm a big fan of testosterone replacement therapy. I've been on replacement therapy, I think, since 2003 to 2005, somewhere around 2005, I think it was. And I've seen great results with it. And so have many of my clients over the years that I've referred to go get checked out and get prescribed a TRT if their blood work dictated. Now, I'm going to get into that. But even lately, even retired multiple Olympia winner Dorian Yates recently said that he is also on testosterone replacement therapy and appreciates its benefits. So I'm going to lay out here what testosterone replacement therapy is and what it is not, just so we can be clear between testosterone replacement therapy for men, which is safe and effective, versus bodybuilding stacks and doses, which is bordering on the lunatic fringe. So let's get into it. There is a distinctive and qualitative difference between an intended therapeutic dose of pharmaceutical intervention versus supraphysiological doses and polypharmacy done for other reasons and intentions. So let me give you an example here. Let's take an example. Taking 2 extra strength Tylenols for a headache is an intended therapeutic dose that treats a specific symptom. Now, if I was to take 50 extra strength Tylenols and combine it with Xanax and codeine and alcohol and oxycodone, well, that's an entirely different thing altogether, isn't it? Taking pharmaceutical meds in a stacking form in order to produce an effect well beyond therapeutic intentions. So that's the difference between bodybuilding steroid stacking, which is utterly ridiculous, up to 50 times the dose of testosterone replacement therapy guys are taking just in testosterone, let alone the other drugs that go along with it. And for the record, going by the comments that were in the T Nation article, the comments that came after, for the record, just so people know, I come from that hardcore world of bodybuilding polypharmacy. Suggestions that I didn't know what I was doing way back then are ridiculous. I once lectured at Michigan State University on performance enhancing drugs, and in a legal case way back when, I was once named by the Canadian government lawyers as the leading expert on steroids in Canada. So I know, or used to know, as much as there was to know about them back then, but I left that world behind. So any kind of reference that I obviously didn't know what I was doing back then is utterly ridiculous. That's just from people who didn't follow the sport back then, didn't follow the magazines back then, and that's fine, but I'm just making that on a clarification basis. So Let's do some straight talk about testosterone replacement therapy for men. Now, the field of hormone replacement therapy for men and women has come a long way in the last decade or so, and it's breaking further ground in just the last 5 years. In fact, one of the fastest growing areas in medicine today is the use of testosterone therapy in men, particularly during the middle years, and for good reason. The truth is that testosterone is involved in so many biological functions for men that it's difficult to come up with a biological system that's not affected by testosterone. As such, testosterone is considered one of the master hormones in the body, along with thyroid, leptin, adrenals, estrogen in women, etc. I may have left one out. Now, here's a point that's important enough to throw up on the screen. Testosterone is important for optimal healthy function in so many ways, just beyond just mere sex drive. Let me say that again because I garbled it. Testosterone is important for optimal healthy function in so many ways beyond just mere sex drive. So that's very, very important as well. So you got to consider that. Now, experts are now considering testosterone not just as a gonad hormone, but a brain hormone as well. And you can find that in Morgenthaler's book. I will include in the references at the end. Just as a side note, sometime when I used to do these webinars, I would throw up studies as I'm talking, and the studies would come on the screen. For this one, I'm just going to give you some what I find pertinent references. I'm going to include them at the end, and then you can follow up on your own if you want. So I'm not going to throw them up on the screen as we go because all you'd be seeing is studies. So. But Morgenthaler's book, I think, is important if you want to get into it, and it's well referenced and peer reviewed, so that's important as well. So let's just considering testosterone not just a gonad hormone, but a brain hormone as well. In fact, a lot of the reported brain fog that so many people attribute to diet, stress, or other lifestyle factors often clears up completely with testosterone therapy in both men and menopausal, postmenopausal women, actually. So testosterone replacement for women is subject for another article, but I have discussed it before, and you can probably find that by searching my YouTube playlist, Live Webinars with the Coach. But yes, testosterone levels decline with age. Now, some people argue that since testosterone decline, and changes in our hormonal production is a normal part of aging, that this should just be accepted instead of treated. Now, I find that outlook to be a little bit silly and a little bit myopic, and I'll tell you why. It's like saying that dementia or Alzheimer's or Parkinson's are part of aging and should be accepted and not treated. I think any treatment that enhances your quality of life should be considered for anyone. We're living longer than ever before, which means there are new things to consider that have never been necessary to consider before. So there's little point in adding years to your life if you can't just as equally add life to your years. So let me say that again, and we'll throw it on the screen. It seems to me there's little point in adding years to your life if you can't just as equally add life to your years. And there are things to accept about aging and things to rail against about it. And you can read about those things in the 2 books behind me that I wrote, The Aging Proposition, How to Age Gracefully if you want, or Mindfully, or however you want to put it, and my book, Physique After 50, which hopefully I'll mention again near the end. But just because some elements of aging are natural, this doesn't mean that we should resign ourselves to accepting all of them, especially if they're treatments that are relatively harmless, effective, and helpful to our quality of life. Telling people to accept natural changes that are for the worse is like telling people not to wear eyeglasses when their vision starts to fail. It just doesn't make sense. We have the technology and the scientific advancement to enhance quality of life in many arenas, and testosterone therapy falls into this category, and we should consider it. Or if you're out there and you have the symptoms that I will get to in a minute, then you should consider it and talk to your doctor. I also find it tremendously hypocritical that we live in a day and age where everyone will go out and get Botox and dozens of other cosmetic procedures, spending hundreds and thousands of dollars in order to look better on the outside, in order to make an effort to fight and combat their own nature and their own aging, but somehow people have a problem with medical intervention to feel better and function healthier on the inside. That makes absolutely no sense to me. So I think I'm gonna put this paragraph up on the screen for you to read as well, and leave it there for you to look over. But again, I find it tremendously hypocritical that we live in a day and age where everyone's going to go out and get Botox and dozens of really expensive cosmetic procedures in order to look better on the outside, and in an effort to combat your own nature and your own aging. But people have a problem with medical intervention to feel better and function healthier on the inside. And again, it just doesn't make any sense. So now to testosterone itself. Testosterone obviously affects the male libido, and sexual performance, but its effects go much, much deeper than this. As we said, they're already looking at testosterone as a brain hormone as well. So testosterone also affects mood, affects thinking, cognition, muscle and fat distribution, and your sense of vitality and well-being. So talk about your triangle of awareness here: mental, emotional, physical, physiological elements of your existence. Testosterone has direct and indirect effects on all these three sides of your triangle of wellness. So keep that in mind as well. Now, testosterone treatment, as in testosterone therapy, is safe, relatively safe, and it's easy to screen for as well. Common symptoms of low testosterone, of course: low libido, low sex drive, for those who don't know what that means, low energy, low overall vitality, weak erections, and chronic fatigue, tiredness, sluggishness, etc. Experiencing any of these symptoms for an extended period of time would tell you to ask your doctor for a blood test to include all indices of measuring testosterone levels. These symptoms of low testosterone are often confused not just with depression, but with low thyroid as well. And very often the two conditions can coexist. One negatively impacts the other, which is often what is referred to as a negative feedback loop. So that's important to consider as well. Oftentimes low testosterone is misdiagnosed as a thyroid issue or whatever. And I remember when I first went and got checked out, I wasn't getting checked out for testosterone. I asked for a blood test, and I was commenting to the doctor that I felt kind of sluggish and tired, not my usual get up and go. It had got up and went, but I was still feeling okay. And we were testing thyroid, of course, and everything else, and that's when my testosterone levels came back as out of the normal range. And since then, within a couple of weeks, boom, I was back feeling like myself again, and vitality and virility were back as well. So now we need to discuss some caveats here. The previous belief that testosterone is risky for prostate cancer is false. Even taking testosterone after prostate cancer treatment is now considered safe. A 2004 research study reviewed over 200 medical articles and couldn't find a single one that showed a compelling argument for connecting higher levels of testosterone with prostate cancer. And in the references below, a couple of those books, they refer to these studies, so I'm not going to dig out the studies. You can look in Dr. Morgenthaler's book, and the reference section has all these studies in there. So, but this myth pervaded the medical community for decades until now, and some doctors still aren't up on their research and still think that this is a risk issue. And this is one reason it's taken so long for the medical community to come around and endorse testosterone therapy for low testosterone treatment. One of the other reasons, of course, testosterone therapy has taken so long to penetrate the medical community is, of course, because of the backlash against rampant use and abuse of performance-enhancing drugs among athletes, bodybuilders, recreational abusers, whatever. So many factors have gotten in the way that it's had a trickle-down effect to doctors prescribing testosterone for positive uses for patients with low testosterone. But this tide is now turning in favor of treatment. And again, myself, I've seen dramatic positive changes in my clients who I recommend to go see a doctor, or better yet, better yet, get a doctor to refer them to an endocrinologist or a urologist or an internal medicine specialist. I still have clients who come to me and go to doctors who won't even screen them for that, for low testosterone, which is absolutely ridiculous. If you ask for it, then they should provide it. So they get diagnosed with low testosterone, treated with testosterone, and practically everything about how they feel changes for the better in a short time. So this is something I think is important enough to put up on the screen for you to read and see and go over. They even become people on testosterone therapy, replacement therapy, even become more consistent and committed to their diet strategy and their workout training programs. Now, if you think about it, that doesn't seem connected, but it makes a lot of sense, of course, on so many levels. Correcting testosterone levels increases your feelings of vitality. As I already mentioned above, testosterone levels, when they're adequate, when they're normal, also affects muscle and fat distribution. So if low testosterone levels were preventing results from diet and exercise previously, and you're already tired, and you correct these things, and you feel better, more vitality, and you also start seeing results from diet and training efforts because testosterone is normalized now, so you got better muscle to fat distribution, then of course these results are likely to make you stick, keep you motivated, stick to your efforts, and be motivated by the results you start seeing, which aren't false results. They're not drug-induced results. You're just bringing your hormone levels back into functioning, working levels. And I remember when I first went, I had made the rationalization when I first went to my doctor. Again, I wasn't seeking testosterone replacement therapy. It wasn't even on my mind. But I remember being softer in my physique and stuff, even though my training was sound, being an expert and all. And I just thought it was a normal part of aging. And then, of course, once my replacement therapy brought my levels back into the normal range, into the medium to high normal range, then everything was corrected and I didn't have that soft look anymore. So let's go over again symptoms of low testosterone because they're numerous. First things first, most men who will experience low testosterone, to a degree where it negatively impacts your life, that's going to be men in their mid-40s or older, although I have seen men in their early 30s come to me as well, especially men who have previously abused performance-enhancing drugs, as I did, as Dorian Yates did. I've even had a few write me since that article on T Nation in their 20s who have zero testosterone levels, and they're asking me about testosterone replacement therapy. So it's far more common than you know, and the estimates are that about 40% of men over the age of 45 have levels of testosterone so low that treatment would help them immensely. But there's something else to consider here as well, and we're going to put this up for you to see. A common symptom that is very hard to diagnose because it's so general is one that also denotes potentially low testosterone levels, and it's kind of what I referred to above, but I didn't hit the nail on the head for you. It's not so much that you feel bad, but you don't feel great either. You don't feel like your former self, your younger self for a long period of time, and you let it go on long enough, you just chalk it up to things like age, stress, lack of sleep, other commitments, divided energies, things like that. I know that's what I did. And you often just feel tired, maybe lazy, and some men experience emotional apathy along with these effects. Now, these symptoms of low T, the emotional apathy, can also be practically identical to what is called dysthymia. PubMed defined dysthymia as a mood disorder consisting of the same cognitive and physical issues that occur with depression, but with less severe and longer lasting symptoms. So depression and various mood disorders are often confused and conflated with low testosterone. So you have low testosterone, but you're getting treated with depression meds or anti-anxiety meds or things like that. So very important to distinguish and get tests done. And this is why, because often these things are getting confused with other issues and other symptomology, and that's unfortunate. It can be corrected with proper testosterone replacement therapy. And individuals with depression, of course, obviously often feel helpless and hopeless, and low testosterone is not marked by that specific distinction. So there's a difference between clinical depression and low testosterone. Low testosterone doesn't usually make people feel hopeless and helpless, but that's a fine line for some people sometime. So it's important to get checked out. Now, with prolonged low testosterone, you just experience a more flatlined existence. You just feel off, but you've accepted it for so long that your off becomes your normal. You're just more overall blasé about things, about life, about your own life, about sex, or whatever, more than before. All other life factors being equal, of course. But there's a danger here as well. If you let this feeling of feeling off go on long enough, then, like I said, you just end up assuming it's your new normal, and that's not good. You accept it, whether you ever really questioning it or not. And I've seen this happen over and over again with men as they age. They just come to accept it as part of aging, when it certainly doesn't have to be, or even though it is, it can certainly be treated. Now, the low testosterone checklist. Here are some of the more common symptoms and experiences of men with low testosterone. You start to experience low to very low libido, desire for sex. Your strength and frequency of erections diminish as well. This isn't always an erectile dysfunction issue that's solved with Viagra or Cialis. Sometimes these ED meds are treating symptoms and not causes. So, physiologically, the reason a man may not be able to get it up is because he's not feeling up. He's not up in general, and his effects are more libidinous than they are in terms of being erectile related. So men with low testosterone experience less morning erections, which, as most men know, nocturnal or early morning erections are common when testosterone levels are optimum, when you're young, things like that. And some men can experience trouble with orgasms as well, but to be clear, it's not just the sexual symptoms that mark low testosterone, and thinking it's only sexual symptoms that testosterone can treat is limited thinking that can blind you to the many other benefits of testosterone replacement therapy, like I said, emotionally, mentally, cognitively, all these other benefits that the experts are now seeing, urologists and endocrinologists are seeing, by bringing testosterone levels back into normal to high normal ranges. So this is where so many men get off track. Overall energy levels are also affected by low testosterone. Do you feel more tired than you used to, and more tired than you think you should feel? And what about your daily levels of enthusiasm? Are you enthusiastic about your day, about working out, about other activities you enjoy or used to enjoy? These are things to think about. Does everything kind of seem dull or muted to you, like you don't get excited and up for things that used to get you going, used to get you excited, you used to love to do, and now it's kind of ho-hum? They're still okay, but you're not receiving the same beneficial feelings you got from these activities that you used to get. And what about terms like virility and vitality? Think of these terms, virility and vitality. Do you feel you have less of both of them in a noticeable way? And furthermore, often you yourself may not even think that you're grumpy or less of a joy to be around, but people in your life may notice such things. So ask the important people in your life if they notice a difference in you in the last little while. There's physical differences, of course, with low testosterone. Like I mentioned, muscles just might look softer. You can put on belly fat around the waist more easily, just like women who are going through menopause, same thing with their estrogen, progesterone. And while, yes, this is going to happen and can happen simply because of aging. It can also be a symptom of low testosterone, which happens with aging. And if this symptom exists in combination with some of the other symptoms like I listed, and again, I refer you to the books behind me, The Aging Proposition and my book, Physique After 50. But again, with low testosterone, not all symptoms are sexual, and even the sexual ones may not be all that pronounced for you. So it's an important thing to consider. It's not likely that a person with low testosterone is going to have every single symptom, but the more of these symptoms you do have, the more likely testosterone therapy can help. So let me say that again. The more of these symptoms that you do have, the more likely testosterone therapy can help. When testosterone levels drop far enough, men can experience hot flashes just like menopausal women do. Men can experience clamminess, cold sweats, sweatiness in general. Low testosterone even have effects on posture, and that makes sense when you think about it. If you're tired, cloudy-headed, listless, then you're more likely to slouch than you are to stand up straight. And that also affects our sense of well-being and vitality, and that's shown in research with or without testosterone. The more we slouch, the more tired we tend to feel. The more posturally erect we are, the more vital we tend to feel. So these symptoms of low testosterone, they come on slowly, often barely noticeable at first. And because of that, some men will let not feeling like themselves go on for years, not just months, before thinking there may be a reason to go get checked out. And that's what this video is really for. Not to mention to illustrate the difference between hormone replacement therapy for health and well-being and therapeutic doses versus, like I said before, taking insane amounts of performance-enhancing drugs for entirely different reasons. So let me get to the element of blood tests as well. A blood test may not tell the whole story. Yes, a blood test can easily show when testosterone levels are beyond the normal range, out of the normal range. That one is easy to diagnose. However, and this is important, when blood tests reveal low range normal, so still in the normal range, but in the lower normal range, it can still indicate low testosterone that a person could benefit with testosterone therapy treatment. And I've seen this example dozens of times as well. Many of my clients over the last few years, they go see their doctor. Many endocrinologists, urologists speculate. Far too many family doctors are dismissing low testosterone as a treatment just because blood tests indicate testosterone as being in the normal range, even though it's in the low normal range. And that can be a mistake because it doesn't help people. Furthermore, many labs that do blood work will only mark a blood test for being low testosterone if the test is in the very low range and if the numbers lie outside of the normal reference range. So this sometimes leads to just ignoring the fact that a man has all the exhibits all the symptoms of low testosterone, and yet the blood test is ignored just because it happens to be in the normal range, even though the low normal range, and so it's not even checked for the doctor to look at. So that's important as well. So if the testosterone is in the low normal range, and if all the symptoms on top of that are present, then treatment to bring testosterone levels back to mid-normal range or even in higher normal range may be in order. And I'm going to throw a quote up here. In fact, as testosterone therapy expert and urologist Dr. Morgenthaler put in his book, and we'll throw a picture of the book up at the end. But here's the quote: men exhibiting low testosterone symptoms, but with just below normal testosterone levels, these men respond just as well to treatment as men with unquestionably low levels of testosterone do. So let's read that again. That's from his book in 2013, page 198. Men exhibiting low testosterone symptoms, but with just below normal level testosterone levels, these men respond just as well to treatment as men with unquestionably low levels of testosterone do. So that's an important distinction. Like I said, just because a blood test may reveal you're in the normal range, if you still have all the symptoms, then that still might be too low for your particular body and your particular physiology and hormonal balance. Within a few weeks of testosterone therapy, you're likely to feel like your true self again. Shortly after beginning testosterone replacement therapy, energy, mood, enthusiasm, libido, they are all up again instead of flatline. But it may take a few weeks. But your head is clear and less foggy. You feel the essence of your younger self again, or the real you again, that you may have lost track of just because you let it go on so long. And of course, there can be physique effects as well, but this is more of a correcting the effects of low T than of anything like a steroid effect or anything of that nature. It's like I described about myself above. So people in your life will notice the positive effects and positive changes in mood and attitude as well, and there will be usually some distinct physical changes, physique changes, desirable physique changes. Now let me pause here for a minute. With all this stuff that I'm talking about, I'm not a medical doctor and I don't claim to be a medical expert in this arena, but I am a keen observer and note taker and researcher, and I've trained and coached men and women for over 4 decades now. And my opinion is that daily testosterone use, as in gels, I like the testosterone gel, is far superior than the twice monthly or so injections. Some endocrinologists and experts in this area suggest that if you're going to go the injection route, then weekly injections at a lower dose make better sense than higher dose injections every 3 weeks or so. But again, going back to Dr. Morgenthaler, an expert in this area, he said 3 weeks may be too long between injections. Nearly all men are back to their low-level testosterone levels again by 10 to 14 days, and in some men, the testosterone levels can really bottom out after that. That's from his book, The Truth About Men and Sex, from 2013, and that's page 197, so we'll throw that up there for you to see as well. The fact is, low testosterone is very common in middle-aged and older men, and men can benefit from testosterone therapy, period. Boom. Okay, that's what you need to know. When it works, and it almost always does, you feel whole again and you feel better in many other ways than just simply an improved libido and better erections. You function better both as a man and as a person. So isn't that worth considering? I would think so. Testosterone treatment is not performance-enhancing drug use. Let's be clear about that. As a matter of fact, let me put that up on the screen. I'm just going to highlight it here, and we'll put it up there for you to read. It's an important distinction. Testosterone replacement therapy is not performance-enhancing drug use. They are entirely different things and entirely different worlds. Now, some people have written me in the past, and I think they're trying to fool me because they'll write and say they're under doctor's care for testosterone replacement therapy, but then the list of drugs they are taking is way too long for that to be true. So what I'm talking about here in this webinar is only about testosterone replacement therapy. I'm not talking about HCG. I'm not talking about anti-estrogens. I'm not talking about Clomid. I'm not talking about any of these other drugs linked to what guys take in between steroid stacks. These are two different worlds, and they should not be confused with each other. Now, let me put this one up here as we're getting near the end here. Testosterone treatment for low testosterone helps men to regain lost physical, mental, and emotional vitality and energy. It improves libido and erection quality. It can increase muscle mass and strength, contribute to fat loss, which in and of themselves will combat the effects of aging in other ways. Testosterone treatment can also strengthen bones and improve cognition and mood as well. Testosterone treatment gives men and women their virility back. So this is really, really why it is worth considering. If you're in your 40s and you just don't feel right, you just don't feel like you have the energy you think you should have, go get checked out. Now, not everyone is going to respond fantastically to testosterone replacement therapy. I'm not a huckster for it. I don't make any money off this. I'm not selling supplements here. I'm not trying to make you believe in magic. But if people aren't responding to testosterone replacement therapy, it's usually a dose-related problem. Many doctors still underprescribe it when it comes to effective doses or type of treatment. For instance, like I said, I favor the topical gel over injections because you take it every day. But again, let's be clear, I'm not a doctor, and you are better off not just taking the subject up with your family doctor, but instead get a referral to an endocrinologist or a urologist or an internal medicine specialist and discuss it. Don't be shy about it. Of course, this is just my opinion, but as Dr. Morgenthaler put it in his book, and here's the quote again, we'll put this on the screen for you, you can read along. As I see it, low testosterone is under-recognized, underdiagnosed, and undertreated. In my own practice, I have seen far too many men with low testosterone who had been discouraged from trying testosterone therapy, or they were told they didn't have the condition. Yet, many of these men responded to testosterone therapy beautifully, and they feel they are healthier and happier, in addition to being better sexually. Now that the fear of prostate cancer from testosterone therapy is finally disappearing, finally waning, there is no good reason to deprive men of a treatment that can help them regain their mojo. And that's from 2013, page 199. So let me just emphasize the bold part here. Let's throw this up. There is no good reason to deprive men of a treatment that can help them regain their mojo. And to that I say, boom, shakalaka, boom, boom. Again, there's no point in adding years to your life if you're not equally adding life to your years. So for any of you men in and around 40, over 40, reading this, or if you're the spouse of a man and you're experiencing any of these symptoms I've outlined above, and you just haven't felt like yourself for a long time, then why not go get checked out and have a discussion with your doctor about testosterone replacement treatment? You may end up wishing you had done this sooner. I know I did. So yes, we all must age, but if we can live better and function better with proper medical intervention, not self-medication, proper medical intervention, then why wouldn't we pursue that? You can sit in a rocking chair and rock away your golden years if you want, or you can join the Platinum Club, boom, and still be hanging and banging with the young bucks in the gym and in your life. So I hope this helps you consider testosterone replacement therapy on a realistic level. Look into it. Testosterone replacement therapy in men is a vastly different thing than is performance-enhancing drug stacking and bodybuilding. So I'm going to post what I think are the key references here that talk about the studies that I referenced. Again, I'll just post all these references up on the screen at one time. The important ones are Morgenthaler, his book, Testosterone for Life, and The Truth About Men and Sex. I think those two will give you all the references if you want to pursue further reading. And of course, the two books behind me that I wrote myself, Physique After 50, What You Need to Know About Training as You Age, and of course, The Aging Proposition. Just how to accept what you need to accept and how to, rail against and live more youthful, not younger, but youthful, as you can as we age. So that's testosterone replacement therapy for men. I hope you got something out of this. If you did, please leave comments down below. I look forward to hearing what people have to say. And what do you have to lose by going and get checked out? So again, I think some of you will get it, some of you won't. And look into it. All you have to risk is feeling better and doing better and functioning better. So I think that's worth a boom. And I will see you all in the next webinar, the next video. And again, feel free to leave your comments, and I'll be back soon.